Hello, class. Dr. Beverly here. And this video is another application video that uh, not only describes some key parts of cognitive therapy, but also shows cognitive therapy being applied to a particular population. And in this case, we see that we're looking at high risk offenders. Now, what that refers to is folks who are in the criminal justice system. They could be incarcerated currently or on probation or parole, but they're identified as having a high risk of reoffending. Maybe they've had multiple prior arrests and they had early involvement in the criminal justice system, but the term recidivism refers to folks being incarcerated again or getting pulled back into the criminal justice system because of violating the law. Now, what we know about cognitive therapy is that um, our behavior, like, say, committing a crime, is not just impacted by the environment that we're in, but also our thinking. As we saw in a previous video I did on the rational, emotive, and cognitive therapies, there's an activating event. There's something that happens in the world, and then of course we have an emotional reaction, but something happens in between. There's things that happen in the world around us, and then we make sense of it in a certain way. We interpret what's going on around us. And those interpretations or those thinking patterns are also what drives the emotional reaction and what drives our behavior. And what we know from the research is that there are certain criminogenic or criminal thinking patterns, certain cognitive patterns, ways of thinking that make involvement in criminal activity more likely. And so we're looking at a group of folks here that, if we were to look at a disorder in the Diagnostic and Statistical Manual of Mental Disorders out there that best described people who are routinely violating the law, the disorder is known as antisocial personality disorder, or you see ASPD up there for short. In earlier editions of our diagnostic manual, in earlier editions of that book that contains all the different mental disorders out there, this same disorder, antisocial personality disorder, is actually referred to as psychopathy or psychopath. And also in earlier editions, we're talking, over 50, 60 years ago, they actually used to call this sociopathic personality disturbance. And I mention that because if you ever hear that term, like, oh, that person's a psychopath or that person's a sociopath, those were the old terms that we actually used to use to describe people who would routinely violate the rights of others. So they're breaking laws. When they're breaking laws, that often means like maybe assaulting others, stealing from others. These are also folks who can at times commit um, acts that hurt other people, but not really feel a lot of remorse. You see that lack of remorse there as one of the sort of parts of the diagnosis, if you will. And so that's part of what feeds the behavior pattern is the person will engage in behaviors that could harm other people or society, but they'll minimize the impact of those behaviors on others or kind of dismiss the behavior or rationalize it or justify it. Someone might steal from a store, that's a behavior, but they may have a thought in their head like, well, it's okay. It's not as bad to steal from Walmart as it is from a person. I mean, Walmart's owned by billionaires, and I'm going to take like a candy bar. Walmart's not going to notice this. And then now I steal. And I might have in my head certain things like a big corporation has already stuff in place that can take care of if something's missing like that. It's different than if I take it from a person. And that way of thinking makes it more likely that you would steal, right? And so when it comes to antisocial personality disorder, you have this disregard for other people's rights. The person tends to be like impulsive and even like deceitful or will mislead others. And a lot of what drives that is not really having empathy or remorse, and the lack of remorse or empathy that comes from sort of the thinking patterns that justify the behaviors. Here you see a slide that kind of describes personality disorders. My life's been totally screwed up for years, but no one stepped forward to claim responsibility. These are people that if you get arrested, they will minimize even the impact of their behaviors and say, well, others had it out to get me. I was in the wrong place at the wrong time. Oh, maybe doing the wrong thing, though, right? So when it comes to criminogenic risk factors, there's like what are called the big four, the big four things that lead people to finding themselves back in jail or prison. A history of antisocial behavior, so people that have frequent contacts with the law throughout their life are more likely to have it in the future. It's one of the best predictors of future behavior is past performance. And then you see here antisocial personality patterns. So that's like your personality, your temperament, how you handle difficult emotions, those kinds of things that lead to, stuff like conflict resolution and stuff like that. So an antisocial personality. And then you see the big one here, antisocial cognition. That refers to criminal thinking. And then lastly, antisocial associates. That means hanging out with folks that are also maybe violating the law. These are the big four things that will lead people to being back incarcerated, or like the big risk factors. A history of criminal behavior. You can't go back and change people's past behavior. A personality pattern, that takes a lot of therapy to like restructure a personality. But you see, antisocial cognition, changing the way you think can dramatically change the way you act. We saw with the mindfulness application that when we change some of the ways that we're thinking, we can change some of the way we're feeling. That stress can come down, even if our situation remains kind of the same, but we can make sense of it different. We can interpret it different. Maybe we're not catastrophizing or personalizing or engaging in some of those thought distortions we saw in that other video on mindfulness as a cognitive therapy application. With this case here, it's not thinking better so you can feel better. It's thinking better so that you'll make better choices and respond to your environment in a way that doesn't lead you to get back in jail. So, when it comes to how we target this population, we want to target high risk offenders, not the folks that are in and out for a DUI, but really looking at the people that are consistently getting in trouble with the law. And then what do those folks need? Well, what they need is we actually have to target the criminogenic risk. We have to target some of these ways that these individuals are thinking about their world and then responding to it. And then the principles there is using a cognitive behavioral approach of getting people to maybe pause and examine some of the thinking patterns that lead to some of the behaviors that are then getting them in trouble. So, some of the typical target areas for treatment, problem solving, being able to manage your emotions and anger better, cope with difficult situations, recognizing some of those risky thinking and feeling patterns. Also, being able to resolve conflict better, repair relationships, improve your interpersonal communication skills, and better manage impulses and not be so reactive, and maybe helping people be more reflective. And then also frustration tolerance, dealing with difficult situations in a way that doesn't make them worse. There's a bunch of different cognitive behavioral approaches that actually exist out there, if you will, when it comes to working with justice involved persons. And you see some of them here. Thinking for a change is one of those bullet points you see on the left hand side. The Arizona prison systems have been using that one for a while, off and on for years. When I was the lead psychologist for the Maricopa County jail system, this is back in my forensic psychologist days, I actually implemented in the Maricopa County jail system, specifically at 4th Avenue, which was our supermax facility, where we have folks that are facing multiple felonies and very likely, facing some prison time. When I was in that environment, I implemented a group that was a criminal thinking group. It was called Changing Directions, and it was designed to better help inmates avoid being arrested again when they got released. And here is that group that was put in place. So this is a group counseling program. It was 5 sessions long. Sessions 1 and 2 are where the inmates or the participants, your clients, were learning more about how our uh, thoughts affect our behavior. And kind of that slide you saw early on, where there's an activating event, there's something that happens in the world. And before we have an emotional reaction and start acting a certain way, we first interpret it and make sense of it, right? So that's what those first two sessions were heavily focused on. And session three was managing anger. Session four, repairing relationships. And then session five was kind of pulling everything together, connecting the dots, if you will. Now, notice at the bottom here, you see, excuse me, the criminogenic cognition scale is administered in sessions 1 and 5. So the criminogenic cognition scale is what this group used for its outcome measure. So in session 1, we gave the criminogenic cognition scale a measure of criminal thinking patterns to the group members. And then they do 5 sessions, 5 weekly sessions. So they once a week for 5 weeks. And then at the end of the 5th and final session, the criminogenic cognition scale is re-administered. Now, the criminogenic cognition scale you see is a instrument that measures 5 different areas that are kind of associated with criminogenic or criminal thinking patterns. You see, like a short term orientation. That's someone that's kind of impulsive and doesn't think things through all the time. Notions of entitlement. Hey, when I want something, I'm going to get something. Failure to accept responsibility. Negative attitudes towards authority. Insensitivity to the impact of crime. What do those numbers mean right next to the construct? Those are the items on the criminogenic cognition scale that deal with that particular area. So look at that last one, insensitivity to the impact of crime. And what items was that measured by? It looks like it's 4, 7, 11, 12, 14, right? And that's measuring the idea of not being sensitive to how crime affects other people. Well, here is what that criminogenic cognition scale looks like. And you look at number 4. My crimes did not really harm anyone. You can see how that's not really being sensitive to the impact of crime. Look at number 7. A theft is all right as long as the victim's not physically injured. Number 11. Victims of crime, they usually get over it with time. And so you can see that those questions on this particular scale, the criminogenic cognition scale, what were those measuring? Those ones are measuring, if I scroll down here, here's what you just saw on that slide, insensitivity to the impact of crime. And so this here is a measure that is an instrument that's measuring criminogenic thinking. It's looking at different thinking patterns that the person may have. And if you want to just look here at how the group operates, in session 1, we administer it. And then that's when we begin our psychoeducation, if you will, in our group. We're learning about the power of thoughts. And we actually have some therapeutic handouts that we use that we're looking at thinking patterns that are specific to folks that are getting in trouble with the law, right? And then after we spend a couple sessions with, identifying and starting to challenge some of these thinking patterns, we then look at how we're managing anger, intense emotions, and then improving interpersonal skills, communication skills, your ability to resolve conflict. And then lastly, in our 5th and final session, we're connecting all the dots, pulling it all together. People are giving examples, and we're doing some even role plays if we can. And then in that 5th and final session, re-administering the criminogenic cognition scale, so that between sessions 1 and 5, we should see a decrease in those criminal thinking patterns. And so this was a group in which we had incarcerated individuals, inmates, working on changing some of their thinking patterns so that their behaviors would in turn also change. And one last little thing I'll show you here, and I can put this in Canvas for us, is here is an article, a 2022 article, so a fairly recent article, Criminogenic Thinking Among Justice Involved Persons. And this is practice guidelines for those working in probation. But if you want to look at this a little bit more and look at how different criminal thinking, antisocial cognitions, criminal thought processes, whatever you want to call it, there can impact the behavior of those in the justice system, and then can help with interventions like, say, cognitive behavioral type of orient interventions you see there. This could really help those of you that might want to use the cognitive or rational emotive behavioral approaches when working with justice involved persons. And then I just wanted to draw your attention to one more thing here in the article, where you see here are different criminogenic thinking patterns, a description of that pattern, and then a sample criminogenic thought. So if we were to look at, say, justifying and minimizing, that's a criminal thinking pattern. Because what does that mean? That means you're like minimizing the impact of your crime, or you're justifying it. Here's the definition of that: justification or rationalization, minimizing the any harmful behavior with what you did. And then you see here an example. Hey, if I don't sell drugs in my environment, someone else is just going to anyways. So someone gets busted for selling drugs. It's like, yeah, but if I wasn't selling drugs, someone else would just be doing it. And you can see how that's a way of thinking that rationalizes your behavior, minimizes the impact of it, but then also keeps you stuck in those behavior patterns because of those fixed thinking patterns. So this concludes our video looking at an application of cognitive therapy, where we are applying it to a particular population, justice involved persons. In the case of what I'm showing you with this group, a group of incarcerated persons. And then we get to see cognitive therapy applied where even the cognitive distortions are specific to those that would be in the justice system. Uh, I hope this video has been informative and helped with another application to make these things clearer. As always, if you have any questions, comments, concerns, complaints, please reach out to me anytime. Take care.